What are relapsed and refractory myeloma? What is the difference between them?
So when we're talking about multiple myeloma that a patient has had for however long, and they were treated originally for it and responded and it went back away. When it first comes back, that's relapse disease. So basically where you get to a point where there's less than where you started and it starts growing again. That's generally relapsed. When you're talking about refractory disease, you're talking about a kind of myeloma that is either not responding to treatment, meaning that you just had your first relapse, you started on new treatment, and your M spike doesn't budge. That's refractory. Or technically is that it grows again within the first 60 days of starting treatment. So we're talking about a concept of myeloma growing back as relapse disease or refractory disease, meaning that it just doesn't work, the treatment.
Relapse myeloma suggests that the disease is out of control. It's either getting worse off or on therapy. Refractory disease, from usually a clinical trial standpoint and the way myeloma physicians describe it, is myeloma that is not been responsive to therapy or started progressing within 60 days of stopping therapy. So oftentimes clinical trial eligibility says that the patient has to have relapse disease and it has to be refractory to the last line of therapy, meaning they progressed or the disease became out of control while on treatment or within 60 days of stopping treatment. That way, it's trying to insert some sort of homogeneity into the type of patients described in a clinical trial so that we're not describing some patients who have lingered on without any treatment for years versus those patients who've gone from treatment to treatment to treatment, one right after the other.
So when we look at the myeloma literature, when we see new information being presented, we often see a characterization of the population as being relapse refractory or relapse refractory to a certain drug. And that over time has generated a lot of confusion as we try to compare results of different trials. So there is a harmonization of nomenclature that was put together by the International Myeloma Working Group. And to make it very simple, a patient is considered, the patient's disease is considered refractory to a given drug if the myeloma progresses while the patient is on that drug or within 60 days of discontinuing the drug. And the patient is considered relapse if the disease evolves, comes back after that regimen or that drug has been discontinued for more than 60 days. So I think one typical example is, let's say the patient receives therapy, a very typical scenario, patients receive therapy with RVD, let's say for a year, and after the 1 year the patient continues on lenalidomide, on Revlimid, and at some point the myeloma progresses. I mean, the M spike goes up by more than half a gram. Well, at that point the patient is considered refractory to Revlimid, but is relapsing after Velcade. So the patient is not considered refractory to Velcade because Velcade was discontinued more than 60 days ago. Those definitions are somewhat arbitrary, but it gives us some guidance when it comes to managing patients, and particularly when it comes to interpreting data from clinical trials.
With relapsed diseases, does it grow back off treatment or on treatment?
It can be in theory either. I mean, there are more often than not patients are not off treatment all that often. So that's why oftentimes we say relapsed/refractory, because relapse can be on or off treatment, but when it's often on, that means that they have become refractory to whatever treatment it grew when it relapsed.
Are there any biomarkers that will identify that myeloma has relapsed?
So there's different types of relapse disease, and we can define them a bit better going forward. But generally speaking, you need to have some degree of M protein or biochemical lab results that basically signify that the disease has returned. So that could be an M protein value. Generally, that's more than 0.5 grams per deciliter in the blood. And then you have certain other parameters in the urine, also your serum free light chains that can potentially be elevated, suggesting that that disease has returned.